I'd just like to introduce, for those of you who don't know, Dr. Broudy. He means a lot to our shul, even before this whole COVID situation. But we know that he's responsible not just for our shul, for another shul, and for the day school, and for his own office and his own employees' health and welfare, especially during this time of COVID. And he's been managing all of that somehow, and his family, not least of all, and by all means, and so it's an honor to have him volunteer some of his very precious time to answer our questions about COVID and the vaccine and the masks and all that other stuff. So with no further ado, I'll let if I don't know if you have any kind of introductory words you'd like to say, but obviously let's. I yield the floor.
Thank you, Rabbi. Thank you. Can you hear me okay? Is it?
Yes.
Yes.
I hear you.
Okay, good. Well, first of all, it's good to see some familiar faces here. I miss everyone a lot, and good to see some familiar names if their videos are not on. So it's good to. So yeah, so we kind of envisioned this to be something, to kind of just basically answer questions, because there's so much data on this stuff and information, and it changes so quickly. It's been really a big challenge since this thing started to really keep up with it. I mean, things change almost daily. And so I didn't know, Rabbi, if there were any questions that people had forwarded to you before, or people could put in questions either in the chat, or there's a few enough of us on the screen, so probably people could just unmute themselves if there's a topic or a question, and I'll kind of do my best to address it and see what we can do to get people's questions answered.
I did get one question from somebody who couldn't make it today. Let's answer this question first. Somebody's asking about the vaccine and fertility issues. There's discussion about that in the news.
Right. So it seems to be a little, a little bit of a, I think it's a little bit of a myth on this one, because we don't really have any reason to believe that vaccines would cause any fertility issues. Now, the two vaccines that are out, maybe we'll talk about the vaccines in general just for a little bit. So the two vaccines that are currently out, there's one from the company Pfizer and the other company Moderna. They're both very similar type vaccines. They're being used under what's called an emergency use authorization, which means they don't have a full FDA approval, but there's enough data to show that it's safe and effective that it's okay to use. But there is still some unknowns with it. So it was not tested in pregnant or breastfeeding women. That's come up a lot in my field too. Moms are breastfeeding. Can they take the vaccine? So even though they have not done really studies in a lot of pregnant or breastfeeding women, all the scientists and certainly the big academy of what they call the American College of Obstetrics and Gynecology believe that there's really no reason this should pose any threat at all. It's not a live virus vaccine, and there's really almost no vaccines that really cause a big problem in pregnancy, except for maybe some of the live virus ones, which this is not. So there's no reason to believe it should be a problem. And it's certainly, they've said if you're able to get it and your tier comes up, whether you're pregnant or breastfeeding, whatever, they say go ahead and get it, because the benefits are going to be way up here and the risks are practically nothing. But it is true, it hasn't been formally studied in pregnant women. But there's no reason to think it should cause fertility issues. I guess that's the other question. Can you have decreased fertility, not just when you're actually pregnant, but before you're getting pregnant, trying to get pregnant? There's really no scientific reason that should be. So I don't think there's really any issues with that at all. And it certainly shouldn't be a reason to not get the vaccine once your tier comes up. But I know probably a lot of women of childbearing age maybe are not quite in the tier yet, but they will be soon. So yeah. And then I think that I see also in the chat here, Rabbi, that says
I have a question.
Yes, ETL.
My wife received the first vaccine on January 20th. They scheduled the second for tomorrow, and they called and said they don't have it, and they postponed it for next week. So how long can she wait to get the second one and be effective?
Yeah, so in general, almost every vaccine that I think maybe everyone that we have doesn't really have a maximum interval, but it does have a minimum interval. So the answer is we don't know 100% for sure is the real answer. But based on what we know from other vaccines, I don't think it would make a big impact if it's off by a month or two. Most of the ones we have, even if it's off by years, you do not have to restart the series. So it probably should be fine. I know there's been some delays because of the distribution of it and everything, but you should be fine.
Okay.
If I can jump in just for a second, it happens to be my mother got her vaccine recently, her second vaccine, and the day before she got information that it was that her appointment was canceled, just like it sounds like ETL got, and she showed up anyway, and it turned out that they had some sort of glitch on the computer where they told people it was canceled, but it really wasn't. It was good that she showed up. She got her second shot. So I would suggest perhaps Sandra should go tomorrow anyway.
We're planning to go anyway.
Good.
It says here vaccine and South African variant. So this brings up a good question. There have been some variants of the vaccine. So all viruses, as they replicate, they're smart. They mutate into different forms. Like we know, for example, with the flu vaccine, every year you get a different flu vaccine that includes different strains, and there are strains that are changing all the time. So unfortunately, we've been beginning to see this with COVID too. The two main strains that people are looking at are the UK variant from out of England, which seems to work. The vaccines seem to be just as effective against the UK variant. The question asked about the South African variant, that's one people are looking at and a little bit more worried about, because it appears that the vaccines are significantly less effective against that South African variant, which has now been identified in several states in the US. I don't think in California yet, or maybe not in San Diego for sure, but I don't think in California. So that is something people are looking at. And it is possible, and a lot of scientists are thinking that we might end up eventually in a situation with COVID like we are with influenza, where every year there's a different vaccine, it's made with different strains. And I know the companies are already starting to tweak their vaccine a little bit to work against the South African variant. It turns out scientifically that's actually not difficult to do for them. So it's not as it is a problem, but it's a solvable problem. But yeah, that's a great question.
So it's still good to take the either Pfizer or Moderna, and then it's not like you have to take another one that protects against the South African variant.
Well, for now, definitely you still want to take whatever you're offered. I mean, Pfizer and Moderna, they're reporting about 95% effectiveness in preventing clinical disease. So it's good to talk about what do we know actually about the vaccines, because there's still some unknowns. So when they did their trials, they basically looked at 30 or 40,000 people. Half of them get the real vaccine, half of them get the placebo, and then they just released them into the world, and they watched and see who got COVID. And when they looked at all the COVID cases in their trial, they found that 95% of the people who got COVID were people in the placebo group, and only 5% were in the vaccine group. So the vaccine is definitely very effective in preventing people from getting sick. We don't know if you're vaccinated, if you could still harbor the virus and spread it to others. That's a big question. So vaccinated people really shouldn't change their behavior too much. In a sense, they should really still, wear masks. You don't know, you could possibly spread it to someone else, even though you're not getting sick. So hopefully we'll be able to answer that question soon, but we don't know that. So it looks like with the South African variant, it's maybe around the 50% level, which is usually about what a typical flu vaccine is, honestly, in a particular flu season. So it's still very good to get. And we feel that, all the vaccines that are in the pipeline, there's Johnson & Johnson's going to be coming out one, and, there's AstraZeneca. I mean, there's all these different ones. and they work a little differently. And some might be, 72%, 90%, 95. Definitely, it's important to get whatever one you can get, because they're all going to be very good at preventing hospitalizations and deaths and severity of disease. So even though it's 50% from getting any kind of, COVID illness, it's still, if someone does get COVID with the South African variant, they'll still very likely be much less severe. And that's a big important point, because the biggest problem that's really happened is the strain on the hospitals and the healthcare system. I mean, the hospitals are still actually pretty full, even though our numbers are getting better. But because people, when they go in the hospital with this, they stay a long time, and they just hard to discharge people. They're there for weeks sometimes. And so, even though, you say, wow, 50%, that doesn't sound all that great, but it's still going to do a pretty good job of keeping people out of the hospital and on ventilators and severity of disease. So the point is, whatever vaccine you can get, don't get hung up on the numbers. The goal here, really, you have to think in a big, massive community way, in a very global way, because the more total immunization we can get, the more we can get sort of back to normal. They say that we'll probably need to get about 70 or 80% of the population vaccinated to really get back to kind of a normal, what we would call normal. So hopefully 70 or 80% of Americans want to get vaccinated. And that's another issue. But yeah.
I heard that those that get COVID, their first dose, they have symptoms, and I don't know, and for
you mean who gets the vaccine, right?
What? Oh yeah, sorry. If they got the vaccine, if they're getting the vaccine, the first dose, they get symptoms. Is there any did you ever hear about that?
So are you talking about side effects of the vaccine, maybe?
Yeah, side effects.
Yeah. So all vaccines have the potential for some side effects. It seems like, at least with the Pfizer and Moderna, there are a good number of people that get a little, feel a little off, ranging from sometimes a fever, aches, chills, a little bit. Usually it's just pretty short-lived. So, I mean, I got as a healthcare worker, I was eligible to get vaccines. So I got Moderna is the one I got on my first dose. The next day I had a little bit of a headache, but I don't know, I kind of get headaches sometimes, so I didn't really make too much of it. When I did the second dose, about 24 hours later, I got a little fever, I got some aches, chills, and I was like, oh boy, okay, I don't know what's going on. And then, but it was really short-lived. It was like 3 or 4 hours. And then I felt pretty fine, actually. So the answer is yes, some people do get those. And it does seem like a good number of people do get some brief side effects. So if you are set up, I mean, get the vaccine whenever you can, but it's nice to not be able to have to work the next day, just in case, yeah, a good number of people have been having some of those side effects, but they're pretty mild and short-lived, and certainly well worth the benefits. So
very often somebody's arm might hurt after the shot.
I forgot to mention, that's probably the most common thing. Yeah. So it does cause a good amount of arm soreness for a couple days.
I don't know. I found out there was on the news article that a San Diegan got the vaccine and tested positive for COVID, but I don't know. I thought it was a dead virus. And do you think it's just that they tested positive for the dead virus? I don't understand.
It's a good question. So first of all, some people have, get a dose of their vaccine and then, get COVID a week later and get sick with it. Of course, the vaccine takes a couple of weeks to really build up an immune response. So it could have been that they were infected shortly before they got their vaccine dose, and then they got sick with it. But you're absolutely right. If someone has gotten COVID, they could be positive, even for a few months in the test. And you're right, it may pick up some dead virus, and you may not be contagious, but you may be positive. And again, the question still remains: if you're fully vaccinated, can you still harbor the virus in your nose and spread it to other people? And so we don't really know the answer to that. So that could make sense that someone who's been vaccinated is positive. Maybe it was positive from before he got the vaccine, or a lot of people are, as you know, what they call asymptomatic, have absolutely zero symptoms. I mean, a good 40 or 50% of COVID cases are totally asymptomatic, which is a big difficulty with this virus. So, so yeah, so it's possible it could have been before, or maybe he got, even though he's been vaccinated, maybe he got infected newly. He feels fine because he's vaccinated, but he tested positive, and maybe that could spread to someone. So we still don't know that.
Okay, so technically, could like, let's say hypothetically everybody in this family gets vaccinated, could you hang out together without masks, or really still mask it?
Well, I mean, if everyone, if everyone is vaccinated, let's say in your household or something like that, so that means everyone's pretty much, is 95% protected. Now, again, it's possible the virus could still spread around. So, but if everyone's protected, I guess you don't care if it spreads around in that small little group, I suppose. So you probably could take a little bit of some liberty. Of course, it's 95% too. So that's still, 1 out of 20, so I don't know. At this point, no one's recommending I mean, if you're in your household anyway, you don't normally have to wear masks around, people of your own household, but I'm assuming you might be talking, maybe you have a group of vaccinated people from multiple different households. I'm assuming what you're saying. For that, at this point, we still should be a little careful, and no one's recommending that we change behavior in that way with multiple households and gatherings, because we just don't know. It could still spread around even though you're vaccinated.
Okay, yeah, sorry, I have a bunch of questions. So with yeah, I hear that, I don't know, Sharp came out with like an article that they were saying, I don't know, maybe it was a long time ago, but they said like if you had COVID or if everyone's vaccinated, then it'll be good. Like that's what we're aiming for. But like if you are, like, people say that once they get COVID, they don't need to get the vaccine. I don't know how effective. I don't know. What are your thoughts?
Yeah, so that brings up a good question. So if you get COVID, are you immune for life? Is the real question you're answering. And the answer is we don't know. It appears that so far, and at least what the CDC has said, is that if you have had a case of COVID, there appears to be a good immunity for at least 3 months, which is why they say if you've had COVID and you were re-exposed to someone, you don't have to quarantine if it's within that 3 months of when you got positive. But we still don't know. I mean, it'd be great if you get COVID once and, that's the end, like it's chicken pox or something. You never get it again for your life. You're immune for life. I mean, that would be fantastic if that was the case, but we don't know if that's the case. And it may be something like influenza that mutates and changes, which it's seeming like it does, which means you may need to get continuous vaccines. So for right now, they're saying for 3 months is the time window where we feel there's a relatively good amount of immunity. But as far as getting vaccinated after you've had COVID, they do say it's still good to get vaccinated even after you've had COVID, because again, we don't know if that infection when you got COVID will create this lifelong immunity or not. So at the moment, they're saying to go ahead, and even if you had COVID, it's still a good idea to get vaccinated. You might want to wait 2 or 3 months just in the interest of the public good. Since you have some immunity for 3 months, maybe it'd be good to let other people get the vaccine, since you don't really quite need it for 3 months, but at some point, yeah, they say it's good to get it.
Doctor, I have a question about that coronavirus in general.
Yes.
You mentioned that it is somewhat similar to our annual routine within flu or influenza. And my understanding is that coronavirus is not something totally new. There was coronavirus 18, 17, and before, probably 20 and 21, I guess. So my impression was that that's the same thing as regular influenza, and you just, I heard the same thing from you. It was a pleasant surprise, I would say. Nobody is talking about it. That's a regular thing which happens every year. And it's somewhat unfortunate that particular variant of COVID-19, that's what they named it, is worse than its predecessors and probably successors. So I feel that that's pretty much the same thing. And my reservation is that the thing with vaccine, like you said, it is in the old vaccines, the flu shots, they work 50-50. I personally avoided, and the reason was that I had my own case. It didn't work on me. I had, I heard of some very severe cases resulting even deaths from that so-called flu vaccines. So they were not very effective in the past. I'm quite surprised that efficacy rates of 90, 80% or some things like that. It just, especially the miraculous cycle for creation such new vaccines with such a level of efficacy. A reservation I have is that it is highly profitable for some pharmaceutical companies. So it kind of puts a big question mark for me. I'm not opposed, but I'm a little bit skeptical
Well,
about
no.
it. Yeah.
Well,
So is it really, good, or it is just people are making billions of dollars on this thing? That's my, How do you feel? Is it really a brand new thing, or it is a sort of a variant of what we've had in the past?
Right. So you actually, there's a lot of substantial topic you brought up there. So the first is just coronaviruses in general. So coronavirus is a known family of viruses. We know of at least 4 or 5 other coronaviruses that cause a common cold, just a normal common cold. So it is in that family. Now the difference is, one, it's a new type of coronavirus, so no one has any immunity to it, which is why it's spreading like wildfire. And also it is obviously, a more severe disease that it causes, right? I mean, it's, in a lot of cases, there's no symptoms or common cold, but there are some people who really get obviously very, very sick. And there's been a lot of deaths from it. It's a similar, it's not the same exact family as influenza, but they are both what we call RNA type viruses. So they do tend to mutate. I mean, if you look at, for example, there's a lot of comparisons people make with the 1918 influenza, the Spanish flu pandemic you may have heard of, right? There's a lot of similarities that, that went through the world, just like COVID is right now. Many people died. And it kind of ended up just being like the flu that we have now. In fact, I read an interesting article that all the strains of flu that we have now are actually variants from that original 1918 Spanish flu. So it is possible that we will end up in a situation where after this goes through the whole world and some people will build some immunity, and unfortunately there are some people who just will die from it, that will end up in a situation where it will be mostly asymptomatic or mildly symptomatic disease. And there may be right now we always have influenza, about 50 or 60,000 deaths from the flu every year. And most of those are older people or people with underlying illnesses. So we may end up in a situation exactly like that. And a lot of people are thinking that, and we're in the beginning phase of the 1918 flu, and the pandemic, that 1918 pandemic didn't go on forever that way. It swept through the whole world, and then unfortunately the most susceptible people, or the weakest people, passed away from it, and then we end up with a low lying level. So it's very possible we might end up in that situation. Now, to address what you said about the vaccination, so a couple things. So the flu vaccine in any given year, you're right, it's about 50 to 70% effective in preventing you from getting the flu. It'd be great if it would be something like the measles vaccine, which is about 98% effective, right? I mean, that's, right. But the other thing that people, and parents ask me this all the time too, because we recommend kids, I'm a pediatrician, we recommend kids get flu vaccine starting at 6 months old, every winter. If you look at the, the severe cases, or people who end up hospitalized or get or die from it, there's definitely a much higher chance of getting a severe flu case if you're not vaccinated. So even though some people will get the flu, and some people get the flu shot and will still get the flu. And you'll think, well, that was worthless. Why did I go and get that flu shot? Wait, I still got the flu. But your chance of getting a severe illness or ending up in the hospital is much less if you've had the vaccine. And so that's, to me, the real reason. And if anything, this pandemic has shown us what happens when the hospitals get full and the healthcare system is strained. So I think it is worth it still to get the flu vaccine. Now, you brought a little skeptical about how fast this vaccine was made, right? I want to address that too. That's a very important point. A lot of people are worried, said, my God, usually it takes years and years to get vaccines. I mean, why, how did this done? Did they cut corners? Did they do the right safety trials? So how they usually make vaccines, the pharmaceutical companies, is they make a small amount of the vaccine and they try it out in a small amount of people. Then they make a little more, and they try it in more people, they make a little more. They don't want to make hundreds of millions of doses of this vaccine before they know it works. That's not a very good business decision. But that's exactly what they did in this time around with the government funding. So they said, if you have unlimited resources, it's just like if you ever see those extreme home makeovers where they build an entire house from the foundation up in 7 days, well, the way they could do that is if you have an unlimited budget and you've got hundreds and hundreds of workers and thousands of workers doing it, you can do it. And so that's kind of what happened in this case. They really did not do anything different in the number of people. Like I said, Moderna and Pfizer, they have 40,000 people in their trials. I mean, really big trials that they did. So they really didn't do anything different, but it was just because of the resources and the upfront money. They made hundreds of millions of doses before they even knew it worked. And luckily it did. And so, it didn't go to waste, but obviously from a business standpoint, that was a very risky financial thing, but it was not a safety risk. It was more of a financial risk. So hopefully that answers some of those questions, but you brought up a lot of very good, important points.
Thank you, Doctor.
Thank you.
Question. Why do Moderna and Pfizer, they have different cooling points? Why one has like negative, what is it, like 90 degrees? I don't even know. I'm just wondering why one takes like such an intense cooling temperature and the other not as much. Yeah,
it just has to do with the way that the vaccine is formulated and the kind of preservatives they use. I don't know the technicalities of that, but it is a little bit of a hassle because especially with the Pfizer one, that's got to be in these really super freezing temperatures. So not all places have it, and it's hard to ship and distribute. So that just has to do, I'm not sure exactly why, but just the ingredients that are in it or the preservatives need to be kept at that temperature.
And how long after you get the first dose? I know like Moderna takes 4 weeks and then Pfizer takes 3 weeks, but let's say you can't, like some people were saying, it's they don't have any more left once you get the second dose. Like how long after you're supposed to get the second dose can you get it? Like let's say after 4 weeks they say like, oh, we're out of supply. So
yeah,
how many weeks after, is it still safe to get the second?
Oh, I think there's no problem with safety. The question, it was what ETL was asking, was is there a point where you might, like, the first one doesn't count anymore and you have to get revaccinated? We don't really know the answer to that question, but based on all the other vaccines we have, generally speaking, you don't need to restart the series. So I think there is probably some leeway, probably for a few months, probably, and maybe longer even. I mean, for like hepatitis B or something like that, I mean, if you got 2 of your 3 doses and then it's 10 years later, you don't need to restart the series. You just get 1 dose and you're done. So most vaccines are like that. And so hopefully this one is, but to answer your question, we don't know 100% for sure, but I think it's probably fine if you can't get it right away. Even if it's a few months later, it probably would be fine.
Thank you.
Sure.
There are a lot of questions about the vaccine. Can we just drop back a little historically, chronologically here? Ask a question about the masks. There's a lot of talk about how many masks, or if a number helps, or quality of masks. Can you discuss that at all?
Yeah, so it's a good question, and this goes back to in the very beginning of the pandemic, we didn't know how the virus spreads exactly. What I mean by that is there's kind of two main ways we think of things that spread. So there's contact, which would be like touching. There's what we call droplets, which is respiratory droplets, which is sort of the main way the virus spreads, where when you sneeze or you cough or breathe out, small droplets of your respiratory tract that carry the virus get out. And then there's what's called aerosol, which is really it hangs around in the air. It's not just a droplet that comes out and falls down by gravity to the floor. It hangs around in the air. So in the very beginning, we didn't really know. And so everyone was taking the utmost precautions with assuming it was aerosol. We were all, wiping down every Amazon box that came to our door and everything like that. Then it kind of went to really thinking that it was mostly droplet spread. So that's really where the masks come in, because anytime you cough, sneeze, breathe, respiratory droplets come out, and they can go a certain distance before they just fall down to the ground. So the masks are definitely critical with that. There is some thought that there is still some aerosol spread in certain scenarios. So, the CDC kind of never fully answered that, but they did say that in closed settings, especially with poor ventilation, there could even be some aerosol spread where it can hang around in the air for a little bit, which is a little bit difficult and concerning, because that's the hardest thing to fight against. But for masks, definitely what they say is, obviously, it's got to, cover your nose. So you see a lot of people wearing their masks like this, which is absolutely, you might as well not even wear a mask at all if you're like this. So it's obviously got to cover your nose and your chin. You want it to be, fairly tight against your face. So there's not a lot of open gaps. And, they usually say, having a multiple layers is helpful. So if your cloth mask has like a couple layers in it, that's good. Things like a little bandana like this that hangs down is really not so great, because the respiratory droplets will just kind of come out from the bottom of it. I guess if it's tied tight at the bottom, that might be a little better. But you see people wearing these little gaiters or these little kind of cloth things around like that. That's felt to not be quite as good as, it's better than nothing, of course, but it's not as good as really a mask that sort of fits underneath your chin and over your nose. So that's kind of the story with the mask. Some people wear a shield, which, can obviously help your eyes. So there is also, it can get in through your eyes as well too, because it's kind of all connected there, your mucous membranes to your eyes. So, if you're going to be, they don't really recommend you necessarily have to go around with eye protection in the street. But if you're, obviously if you're maybe like in healthcare, they tell us to just, I'm looking in kids' mouths all the time. So I just have some goggles that go over my eyeglasses and my mask, and that stays on from the minute I walk in the office till I get in my car at the end of the day. But you might see some people that have a shield like this without a mask. That's not great either. It may help a little, but things are going to drop out through the bottom. So there are some people for medical reasons maybe who can't wear a mask or something like that. And then a shield, I guess, is the next best thing, but it's not really a substitute for a mask.
Thank you.
I know we're all getting tired of these masechot. I know. We're supposed to wear masks on Purim, so we got that one covered, I guess. That's good.
I have a question. What is your take on wearing double masks? I don't know if you answered it or not.
Yeah, it does seem to be that the more layers you have, the more effective it is. Lately, people have seen Dr. Fauci go around with the double mask. So I don't think they've officially recommended everyone have a double mask, but it does provide an additional layers. So I don't know exact numbers, but it might go from 85 to 95% or something like that, or 90 to 95%. So it can give some additional protection. But I don't think there's any official recommendation like from the CDC that we should all be wearing double masks. I think we're happy if we can just get everyone to wear one mask, But
Doctor, How are you, Doctor?
Ruvi, how are you? Good to hear your voice.
Great to hear your voice. It's like a radio station on a Sunday morning. Thank God. Anyhow, question. I don't know if you've answered this because I jumped on the call 20 minutes late, but once everyone's vaccinated at a 98.9% effective rate, is there any thought as to how much longer we have to go doing what we're doing? Or is there some assumption that if everyone's vaccinated at a high rate, you can kind of go back to normal life? Did anyone ask that yet?
Not exactly, but we did address a little when we talked about vaccines. So the goal is, you've maybe heard of a term called herd immunity. So herd immunity means when you get enough people immune in the population that the virus just has really nowhere to go. So it's at a very low level. So it's there, but it's not, spreading around in rapid numbers and getting the hospitals all overwhelmed and lots of people getting sick with it. So most of the experts feel that we need to probably reach about 70 or 80% immunity before we can kind of go back to like normal as we knew it. So if we can do that, that would be great. And the herd immunity happens by either people getting naturally immune, by getting the infection itself, or vaccines. So some combo of that. But we will probably need to get 70 or 80% of the population vaccinated to get to that level where we can sort of ditch the masks and kind of, go back to normal.
But if you had COVID, you only are immune for 3 months.
So far, that's what we're saying. We don't know. It could be longer, and it probably is a little bit longer. But again, because it hasn't been around long enough to know. I mean, with chickenpox, we can say we know, you're immune for life. Well, this is a new strain. It's been around a year, so we can't say exactly. So right now they're just saying 3 months is a precaution. That seems to be pretty conservative, way, but hopefully it's longer. But yeah, that's a big question, really big question that still needs to be answered with it. There have been, I should say, there have been very rare reports of people getting sick with COVID twice. But that's been a pretty rare thing. So it's just a few case reports here and there. So we don't know, but of course there are variants that are happening too. So again, it may be, may end up being like the common cold where, yeah, you can get a common cold more than once, the strains mutate, whatever, but you have some, previous immunity, so you don't get super sick with it. But time will tell.
Question?
Yes.
Based on your aerosol thing, now what we commonly see is when, especially if we're walking outside, we throw our masks on when we see somebody, and then when there's no one around, we just take our mask off. I see a lot of people doing that. I assume some people here do that, but is it wise to do that, assuming that, I don't know what aerosol is, that it stays in the air for 5 minutes or 10 minutes or 3 minutes? People that don't know where they got the virus, is that maybe possibly some kind of reason where they jumped into air that was an hour old but still has droplets lying around, or is that not even possible?
Well, I don't know if we totally know. It is possible, but I think it'd be, at least from what we know from the data, it's probably much more likely if it was in an indoor place that had poor ventilation. I think you're pretty good outdoors because things will dissipate pretty quickly. So I don't think we've found any problems with that. So I think if you're outside getting some fresh air and no one's around, I think that's fine. And if you as you approach someone, you should put the mask on, of course. But I think it's more of an indoor kind of thing. I don't know if there was some poorly ventilated bar and there were 100 masked people in there an hour ago. I don't know. I probably wouldn't want to go in there, for a while. But the concern with the aerosol, at least so far, seems to be more indoors in poorly ventilated places.
So let me ask if I may, real quick, the shul is considering having a Passover Seder this year, outdoors, with social distancing between families, and each family, and obviously a smaller group of people. It'll be outdoors, and there's not going to be physical contact between people, etc. In theory, that should be relatively safe, right?
Yeah, I mean, in theory, it should. I mean, currently, right now, and again, you know, this gets to some of the regulations and stuff too. I mean, I think currently, right now, it's you know, it's supposed to be like no more than three separate households gathering. I don't know if that applies though to religious places. So, but yeah, I mean, if you have, you know, good distance between the different families, outdoors should be pretty good. I mean, you have to be a little careful with what we mean by outdoors as well too, because sometimes you'll see, you know, some restaurants where they have a really nice, sturdy, secure tent outdoors. Well, everything's outdoors. My house is outdoors too, you know, but I made it, you know, I built up walls and now it's indoors, you know what I mean? So, so technically, I think when they say outdoors, I think it's supposed to have three sides open really to get the right kind of ventilation there. But I mean, we'll have to see what the, you know, what the regulations are, but I would think that, I mean, in theory, yeah, if you know, that would be, you know, a safer way to do it, definitely much safer than indoors for sure. And so, but if that's allowed per county guidelines, that might be an option. And if certainly if again, you know, if people were vaccinated, that's even a better reassurance. And you know, we might come to a stage. I think Israel is having things where, you know, people have a carrier vaccine card, have been vaccinated, and that allows you to do certain things. And they're kind of leading the way in the world in a sense, because they have a good portion of their population vaccinated, and they're on track to be maybe the first country to get a good, you know, almost everyone vaccinated. So we may end up, you know, doing something like that, you know, where if you're vaccinated, that'll give you a little more leeway. So, but yeah, I mean, there is still a little bit of this aerosol question, but it appears that it's more indoors, and you know, and it's hard when you gather together, even if it's the three households or whatever, because sometimes things, you know, with time sort of break down. In the beginning, everyone's always separate, but then they kind of start schmoozing, and you know, it's hard.
It's shul, nobody schmoozes.
Right. No one. Everyone's only davening purely, and it's just no.
It happens to be the wall that we have in our tent outside, our tented area in shul, is actually a breathable mesh. So we got approval from the county for that.
You did. Okay, good. Okay, that's good. Yeah. Yeah. You definitely want kind of the, you know, Abraham's tent kind of effect going on. This is a better way. Yeah.
A little bit of privacy.
Question about masks, like wearing, like people reusing masks that they've already used for a few hours or a whole day, that are disposable, non-disposable. Like, what are the rules behind that? Because I've seen someone like reusing a mask that they use the whole day, and then they use it the next day. I'm like, I don't know.
Yeah, well, one thing I should mention too. So I mean, so we talked about the cloth masks. There's also, of course, like you see the surgical masks, which those are actually the best, because they also have like an electrostatic kind of charge, and so viruses will stick more and not get through. So I mean, a surgical mask is the best. You know, actually the best is what they call the N95. That's not really needed for the general population. Those are really tight. I mean, it's pretty uncomfortable. So those are for like really aerosol. If you're going to go where there's, you know, someone on a ventilator, where there might be COVID wafting in the air. So that's the tightest mask. But a regular surgical mask, which you can get too, I mean, those are actually the best, even better than cloth masks. The question is, how often do you change them? Well, if it's obviously, you know, soiled, you know, or wet, or you know, someone sneezed right on it or something like that, I mean, then you of course want to change it. But there's not really an exact, recommendation. I mean, even us with a surgical mask that I have in my office, I usually will use the same one for a couple days, unless again, some kid like visibly, sneezes on it. So, probably just changing them daily is probably, probably reasonable. You do have to be a little careful. Technically, you really shouldn't touch the front of the mask, because that's where the virus could possibly be, right? So when you take your mask off, you want to be a little careful and just get it from the loops. And, if you do reuse it for a day or so, you can, hang it up somewhere and let it air out. I know that in the beginning, there was a lot of, concern with the supply of masks. So they were having I was using my same one for like a week, as long as it didn't get dirty. I just would carefully put it in a little bag so I wouldn't touch the front of it or anything, carefully put it on. But now the supply is a little better. So I usually will use one every couple of days.
Doctor, by surgical mask, you mean those ones that are available everywhere, like at Costco, the blue ones, right?
Yeah.
Okay, because those look like the junkiest masks, but if those are the best, then
they have 3 layers.
Yeah, I think you're right.
All right, thank you. Yeah.
Yeah, the ones that just say, I think those are the ones. I mean, I haven't seen them exactly at Costco, but yeah, but a typical just regular surgical mask, those are pretty good.
And how effective are those? I think you kind of just mentioned this, but if someone coughs in your face, those 3-ply, you said the top layer takes away because there's 3 layers, the top layer kind of takes away whatever was coughed on you, or?
Well, it's like each layer gives like an additional layer. So the first layer will get out, certain percentage, and the second layer will get out whatever remaining's there, and the third will get out whatever the remaining is there. So it's also the way that they're made, the surgical mask. Like I said, there is this electrostatic charge that sort of allows, I think viruses are like negatively charged or something like that. So that it sticks more that way, not just by a physical barrier. So, all the measures, that we have, the distancing, the masks, all the stuff that we do, it's really all an additional layer. So a lot of people call it like a Swiss cheese model, like you have one layer of Swiss cheese and there's some holes in it. And so some things get through those holes. And then you have another layer of Swiss cheese, but the holes are in different areas. So it gets some of those out. And the more layers you have, the better you are in the end, which is why it's really important to have multiple things. You can't just say, I'm only going to keep 6 feet apart without a mask, or I'm only going to wear a mask and not 6 feet apart. You really have to do both. And that gives you the best protection. Those are great questions, guys. Really great questions.
Are there any more questions?
One more. We read the variant COVID-19 is more contagious. What does it mean? It has more of those spike, or why is it more contagious?
I don't know if we know why it's more contagious, but some of the variants seem to spread a little more. Like the UK variant seems to spread around more, even though it doesn't really cause people to become more sick. Why it spreads more, who knows? Maybe it has changes in some of those proteins, those spike proteins that allow it to stick, to become more contagious, to stick on the inside of your respiratory tract more. I don't think we really know why. We just see that, if you look at, if one person has COVID, how many people get infected from there? It seems to be more with some of these variants for whatever reason. So I don't think we have a good answer as to why, but it's a good question. We just see that as an effect, but we don't know why.
Thank you.
Well, Dr. Broudy, I just want to say, as soon as this whole thing began, the board asked your advice about how to keep our shul safe. And I credit, obviously, Hashem, but also his messenger, which is you, with the procedures that we use that have kept us safe. And I really appreciate all of your efforts and all of your time. And I know one of the factors is that we're a small congregation, but thank God, Baruch Hashem, we've not had an outbreak in our shul, and it's important that we gather to pray together when we can. And I thank you very much. Really appreciate all of your help.
Oh, my pleasure. It's been a crazy year, and there's just I don't know. It's we just, like you said, I think thank God, I'm glad that the shul's been safe, and hopefully, as more people can get vaccinated, whatever, as the tiers come up, probably a good, hopefully a good portion of the congregation is able to start to get vaccinated, and that'll extend, and once, I think once, a good portion of the population is vaccinated, we'll be in a good position. So thank you, Rabbi, for all your leadership, and your first year taking the helm was quite a, it's like, okay, we'll change captains right when we head into this very rough storm here, to say, but thank you for all your leadership and for keeping the shul going and doing your best too. So
yeah. Also, if anybody needs help with getting their vaccine, we do have somebody who's helping the community make appointments, and sometimes people have trouble getting the appointment. Let me know, and I can hook you up with a person who can get you vaccinated if you're within the tier. And very likely we'll all be vaccinated, God willing, soon. Thank you again. All right, thank you. Thank you. Have a good
no
rest
problem.
of your...
Good to see everyone. Happy Purim, and hopefully we don't need to have too many more COVID town halls. But if we hopefully it'll go away, so there's no need for it. But if there's still questions, I'm always happy to have another one if we need, as things change, if people have questions. So
great, thank you so much. Have a great rest of your day.
Okay, you too. Thank you,
happy
everyone.
Purim, everybody. Take care.
Happy Purim.
Happy Purim.